Right now, the nonstop conversation about the coronavirus and its societal side effects are taking a toll on the mental health of millions of Americans. I spoke with local behavioral health experts to get some advice on how to cope during this uncertain time.
COVID-19 has seemingly overtaken 2020.
These are really stressful times. These are times of a lot of uncertainty.
Sports seasons canceled, family gatherings called off, schooling abruptly changed to online as the population tries to avoid getting sick while caring for those who are ill and grieving the ones we've already lost.
Our society is going to go through this emotionally as much as they are going through it physically.
I talked with Frank Warren and Caroline Johnson from the SLO County Behavioral Health Department about the mix of emotions coronavirus is bringing on.
Those of us who, struggle with stress, anxiety every single day, we're kind of already in that mindset of, okay, I just need to take this moment by moment and everything will be okay after this. But for people who don't experience that day to day and who are now all of a sudden having these feelings, it can kind of feel like daunting. Like, where do I turn? What do I do?
Social distancing and staying home may feel confining.
It's going to be anxiety, it's going to be depression, it's going to be fear.
The message, you're not alone, and focusing on celebrating small victories will help.
Finding those hope points that they can place ahead of them and work in increments towards those. So even if that means getting through this day, getting through this week, and being able to acknowledge those as victories, because for all of us now who are in this together, we're going to have to take this a day at a time, a week at a time.
Use technology to connect.
Don't forget that you can still emotionally be present with others. Having dinners over the phone, over FaceTime, if you can't be at your family dinner every week.
But find a balance with the screen time too. Prioritize self-care, whether that's a home workout, a walk outside, or meditation. And know that good will come from this crisis.
Thank you to our healthcare workers!
Through strengthened communities and increased compassion.
If you have the opportunity to help somebody else, that will go a long way for your own mental wellness.
If you want to talk to someone, the SLO hotline is staffed and ready to take your call. That number is 800-783-0607, and we'll post more resources on how to cope with COVID-19 in this story on ksby.com.